government now has become rather adept at going after healthcare cheats, so it is getting better and better at detecting and prosecuting fraud.
All right. Let's go to Concord, but we have a few minutes left. Dick, go ahead, please, with Mark Responti.
Yes, thank you. It seemed crystal clear to me maybe 15 years ago or so. I guess I was working for a major corporation most of my career and had, I say, Blue Cross at the time. And all of a sudden, just what the previous two callers ago mentioned, that the hospitals just suddenly stopped sending the bills to the patients. They didn't want the patients to have the bills. They didn't want to hear any questions about the bills. They wanted you out of the loop completely. And I think that's right at that time is when medical costs seemed to escalate, and the fraud seemed to, you started reading more about fraud.
Now, the terminal says that you told our producer that fraud problems started when people stopped getting itemized bills.
Yes, and
right?
Before they stopped actually submitting them to the patient. They didn't want the patient to be involved because I guess he would question and so forth. And the Blue Cross apparently, or whatever the provider at the time was, didn't want to hear. I mean, not only Blue Cross, but a lot of them.
Is there a practice now by hospitals not to provide itemized bills to the patient? Unless you request?
It depends. In some states, it is now mandated by state law that you have to. I don't think fraud started at that point in time. I think it became harder to detect when the benefit explanations were more difficult to obtain. But I understand your point, and I think that the more one can scrutinize the bill and the services that are being rendered, the more difficult it's going to be for this kind of a problem to occur.
Well, is this encouraged right now for patients to look at bills, or just in those states?
I think it's always encouraged. I think as a consumer of any product, you ought to take a close look at whether you're buying a car or you're having a hip operation. But there are movements afoot to provide more and more information to consumers. But just about any healthcare provider that I know, if you request it, you will be given all the information that you desire.
And they would not necessarily discourage you, or are you aware of any policies where this is really discouraged?
No, I'm not aware of any policies like that.
Okay, thank you very much.
Thank you. We have about a minute, 10 seconds. How does the government protect those individuals who come forward to the government?
The government protects them basically by making sure that while the particular allegations are being investigated, that it is done under seal, which means that the case is not known to the defendant. So the government may take 6 months, a year to investigate the allegations brought by the whistleblower. Mm-hmm. Once the case is unsealed or in the light of day, the government protects the individual both physically, to the extent there is any physical threats, and to the extent any type of retaliation is brought against the individual. Those who bring the retaliation will pay both monetarily and by other means.
20 seconds. If people want to get in touch with you, how do they do that?
They can just call my law firm at in Center City at 972-6400 or in New Jersey.
That's the firm of Miller, Alfonso, and Responti.
That's correct.
Mark Responti, thank you for being with us tonight.
Thank you very much, Bernie.
Very interesting subject. We'll break for the news. Return in 5 minutes with an open forum. This is Bernie Herman, WWDB in Philadelphia, the talk station at 11 o'clock.